Good evening, and thank you all for joining us for this very informative webinar, Getting Your Lymphedema Garments Covered, How to Maximize Your Insurance Benefits. My name is Kristen, the Commercial Training Specialist at L&R, and with me tonight I have Heather Ferguson, Founder and Executive Director of the Lymphedema Advocacy Group. We will be answering all of your questions shortly. And throughout the webinar, QR codes will be displayed so you can quickly access the resources. First, for those who may not know, I'd like to briefly mention who L&R is. L&R is a leading international supplier of medical devices. We are a family-owned company and a global manufacturer and supplier. The Solaris collection from L&R features garments and wraps to support lymphedema and edema patients, which were originally designed by an occupational therapist. We also supply bandaging and wound care products. Our North American headquarters is based in Milwaukee, Wisconsin, where many of our garments are made. Now I'll hand it over to Heather.
Thanks, Kristen, and welcome everyone. My name's Heather Ferguson. I'm the founder and executive director of the Lymphedema Advocacy Group, and I'm also the mother of a now 19-year-old son who was born with primary lymphedema, and that's how I got involved in the lymphedema community. When my son was just 7 months old, he was prescribed his first set of compression garments. And when I learned that they were denied by our insurance company and that this was a widespread problem, I basically made it my life's mission to close this coverage gap. So if we can go on to the next slide. I'll just give a little bit of background about the Lymphedema Treatment Act for those who might not know how we got to where we are today. The Lymphedema Treatment Act was a bill first introduced into Congress back in 2010. And our group led the advocacy effort to get the bill passed into law. And it took exactly 12 years and 10 months to the day from it being introduced to pass into law. So it was a very long effort by many, many advocates nationwide. But passage of the bill created a new Medicare benefit category to enable coverage for lymphedema compression treatment items. And it's important to understand that the bill did not change coverage for any other aspects of lymphedema treatment or devices such as pumps or physical or occupational therapy or surgeries or anything of that nature. It was specific to lymphedema compression treatment items because those items did not have a benefit category under which Medicare could cover the items, and that's why the legislation was needed. So the law required that Medicare begin covering these supplies January 1st of 2024, which was just about, a little over 1 year from the time the bill was passed into law. So we worked diligently with the Centers for Medicare and Medicaid Services throughout 2023 as they wrote the rules that would dictate all of the different details of the coverage. Next slide, please. So the law does require a few things to be eligible for coverage. One, you must have a lymphedema diagnosis, and the eligible diagnosis codes are listed here. If you have breast cancer-related lymphedema, it's very important that your doctor use the post-mastectomy lymphedema syndrome code here, as that will give you certain protections and certain coverage under the Women's Health and Cancer Rights Act that are only eligible for women with breast cancer-related lymphedema. You also must have a prescription for any item that you need, and you must have clinical notes that are detailed and support the reason why you need exactly what's been prescribed for you, especially if it's a custom fit versus a standard fit item. The clinical record needs to show why you're not able to use a standard fit garment. Next slide, please. So the coverage is very good under original Medicare now. All custom and standard fit daytime and nighttime garments are covered. Most of these items have codes now that are specific to the type of item, but there are some items that fall under more general codes that don't have a specific a set fee schedule reimbursement amount for them. but just so that every patient knows there's no item that is not covered. And occasionally we will hear from a patient who said this, a supplier told them that an item wasn't covered because it didn't have a code, and that's not actually the case. As I said, there's just a few items that are less common, and so they fall under a not otherwise specified code that is not unique to that item, but all daytime and nighttime custom and standard fit garments are covered. Also, all bandaging supplies are covered, and this is for any phase of treatment, whether you're in the initial reduction intensive phase of treatment or you've moved into the maintenance phase of treatment. All of your bandaging supplies are covered, as well as accessories like any necessary donning or doffing aids, or things like zippers or anything that might need to be added in order for you to utilize your garments. In terms of frequency, the rules allow for 3 sets of daytime garments every 6 months and 2 sets of nighttime garments every 2 years. And defining these by set, not by individual number of pieces, is very important. So a set is defined as one garment for each affected body part. And it was very important as we worked with CMS in writing the rules that they defined it this way, because depending on the number of body parts affected and the number of individual pieces a patient needs to wear at one given time, that can vary greatly. So we wanted to make sure that everyone had equitable coverage and access to the number of pieces that they needed to wear at all times. There's also no limit on bandaging supplies and no limit on the accessories. Next slide, please. So even though your garments are covered by insurance, they're certainly not free. Like all insurance plans under Original Medicare, you do have to meet a deductible first. These items are covered under your Part B. So the 2026 deductible is $283. And after you've met that deductible, Medicare pays 80% of the cost and the patient is responsible for the other 20%. However, if you have a supplemental or a secondary plan, it's very likely that your 20% would be covered by that secondary or supplemental plan. For patients who have plans other than Original Medicare, obviously your deductible and your copay amounts will differ depending on the plan. Another factor that greatly impacts your out-of-pocket cost is what supplier you choose. So when we're talking about Original Medicare, suppliers fall into 2 categories, and the terminology is a little bit confusing. One category is called participating suppliers. So if you use a participating Medicare supplier, they are required by law to accept all claims on assignment. And on assignment means that they can't charge you anything up front, and they can only charge the published Medicare fee schedule amount for each item, not a penny more. And then you, assuming you've already met your deductible, you would be responsible for 20% of the cost of that item. The other type of Medicare supplier is called non-participating, which is very confusing because they can still bill your Medicare even though they're called non-participating. But a non-participating supplier has the choice to accept a claim on assignment, as I just described, or not on assignment. And if they don't take the claim on assignment, they have the right to charge you any amount above the published Medicare fee schedule, and you are responsible 100% for that amount above the fee schedule. So I've put a little simple example here on the slide with nice, easy, round numbers to serve as an example. So if you were to purchase a compression garment that had a Medicare fee schedule amount of $100, yet you went to a non-participating supplier who did not accept the claim on assignment, that supplier can charge you any amount. So let's say they charged you $120, and they have the right to also make you pay that total amount up front. Then when the claim was processed by Medicare, they would pay 80% of what the fee schedule amount was. That means they would pay $80 and you would be left still owing, or still your net out-of-pocket cost would be $40. Whereas if you bought that same garment from a supplier who was a participating supplier and took the claim on assignment, your total out-of-pocket cost would be $20. So this is a very simple example, but you can see the difference is still double. And most garments, especially a custom garment, cost well above $100. So this factor can greatly impact the amount of your out-of-pocket cost. Now, this is specific to original Medicare, but if you have any other type of plan, like a Medicare Advantage plan or any other type of private plan, it's similar in that if you do not use an in-network supplier, your out-of-pocket cost might be significantly higher, or you might not have any coverage at all, depending on the terms of your insurance plan. So the supplier you choose to use can make a big difference in your costs. Next slide, please. So there's a lot of confusion surrounding the difference between original fee-for-service Medicare and Medicare Advantage plans. The standard line that most patients hear is Medicare Advantage covers everything that original Medicare does and more. But this can be very misleading. It's an oversimplification, and we've not found this to be true when it comes to lymphedema compression supplies. So it is true that they do have to cover all the same items, but they don't have to cover them on the same terms. And these details make a huge difference. So they may cover a different amount of quantities. Maybe they're going to only cover 2 sets of garments every 6 months as opposed to 3. Their reimbursement rates can also, they always do differ. They're determined by each plan. So not only is Medicare Advantage reimbursement rates different than original Medicare, but every individual Medicare Advantage plan tends to be different. And of course, they all have their own in-network suppliers, which are determined by each plan. So the coverage you might get under a Medicare Advantage can be very different. And in our experience, we've found over these last 2 years tends to be inferior to that of original Medicare. The Lymphedema Treatment Act only directly requires Medicare and Medicare Advantage plans to cover lymphedema compression treatment items. So while most other type of plans have some coverage for lymphedema compression treatment items, they're not required to cover the same rules under the Lymphedema Treatment Act. So their coverage does vary pretty significantly still today, but that is what we continue to work on as an organization. Our goal is to make sure that eventually every plan provides the same level of comprehensive coverage that is now included under original Medicare rules. Next slide, please. So as I talked about earlier, the supplier you choose is very important because it can have a significant impact on your out-of-pocket costs. So these are some tips for how you might want to go about choosing your supplier. It's always a good idea to ask your therapist or doctor for recommendations, as they're usually aware of what the options are in your local area. Also important to ask your insurance company for a list of in-network suppliers, because as I said, if you go out of network, your out-of-pocket costs tend to be significantly higher, and you may have no coverage at all when using an out-of-network supplier. Now, a little caveat here is your insurance plan has to cover an out-of-network supplier at the in-network cost sharing if they cannot provide an in-network supplier. But getting this to happen can be difficult. What we generally hear from patients is that they're often given a list of in-network suppliers, but sometimes after contacting all of them, none of them actually sell the items that they've been prescribed, especially if it's a custom fit item. So it's important for you to know that you do have the right to go out of network when there is no in-network option available, but you are going to have to show that you did exhaust all of those options and contact all of those in-network suppliers that you were given and prove that they could not provide the item that you've been prescribed. So other ways that you might locate a supplier is to use the Medicare Equipment and Supplier Search tool. And even if you don't have Medicare, most suppliers that take Medicare take other types of insurance as well. However, it's been our experience that the Medicare Equipment and Supplier Search tool is not very accurate or up to date when it comes to lymphedema compression treatment items. And it will often list suppliers that don't sell the items at all, or the types of items they sell are more like your over-the-counter compression knee highs that might be available at the local drugstore. So this prompted our organization to actually create a lymphedema supplier directory that we launched last summer. And that QR code will take you to our lymphedema supplier directory. If you want to try the Medicare search tool as well, there's a link to it from our supplier directory main page. But in our directory, you can use search tools using your zip code or your state to find local businesses. And you can also search nationwide for the vendors who ship nationwide by mail. Right now, you can look at each supplier to see what types of insurance they sell, or excuse me, what types of insurance they accept, and the types of items they sell. And we're currently upgrading the supplier directory so that they can identify the brands that they sell. And we'll be continuing to make improvements to the directory to make it more and more user-friendly and more helpful to patients as time goes on. Next slide, please. So we have a lot of additional resources on our website that we won't go over on the webinar tonight because we do want to save a lot of time for the many questions that were submitted in advance and those that may be put in the chat as I've been talking. But at our website, lymphedemaadvocacygroup.org, you can find a number of things, including a denial reporting form. And we really urge you to use this whenever your garments are either outright denied or you have other coverage issues, because this allows us to track where the problem areas are, where the trends are, and know where to focus our time and energy on addressing coverage gaps and problems. We also have an appeal resources page, and this is for all types of insurance. There's different links and different resources there about how to go about appealing any denial you receive from whatever type of insurance you have. We also have a coverage report, and that's new. We just issued our first insurance coverage report in the fall of 2025 to help people make a more informed choice during the open enrollment period. That is still available on our website now, and we will be continuing to do that each year. So in 2026, during the month of September, we'll be encouraging everyone to take our coverage survey, and then we'll take the information and data from that survey to release a report, usually by around November 1st when open enrollment starts, to help you choose your plan for the next year. We also have additional insurance information. There's a separate page for each type of insurance on our website, including unusual situations like if the patient is in home health, receiving home health, or in a nursing facility, or something of that nature. Our Lymphedema Advocacy Group website also has any current advocacy actions that you can take. For example, right now, there's a public comment period available about Medicare Advantage plans. You have until next Monday, January 26th, to submit comments about the Medicare Advantage program. You do not have to be a Medicare Advantage beneficiary to participate. So even if you have a friend or a family member who's had a problem with coverage under Medicare Advantage, you can use this opportunity to submit feedback. And there's some other advocacy actions as well available through the website right now, and just other ways to get involved. So if you're not already on our mailing list, I would encourage you to sign up for our newsletter when you visit the website, because that's the best way to stay up to date and informed. Next slide, please. We also launched a second organization early in 2025 called the Lymphedema Education and Awareness Project. And we did that because the Lymphedema Advocacy Group is a 501c4 nonprofit, because the majority of our budget over the years has been spent on lobbying related activities to pass the Lymphedema Treatment Act, and we continue to do lobbying types of activities, speaking with lawmakers, policymakers, and other opportunities to advocate for improvements to coverage. But now that we're moving also in the direction of putting a lot of time and energy into educating people about the new coverage and spreading awareness about the new coverage and empowering patients to know their rights, we wanted to launch a second organization that was a 501c3 nonprofit, and that is the Lymphedema Education and Awareness Project. So we've moved all of our education and awareness type of information over to this new website. So there you can find a lot of helpful information. We have free information cards available for order. We also have a lot of different handouts that are meant to be printed on standard paper. There's some specific for patients, some for suppliers, and some for providers. We also have patient resources like provider directories if you're having a hard time finding a certified lymphedema therapist in your area or a doctor in your area, or if you need financial assistance, there's links to some compression garment assistance programs, and our new lymphedema supplier directory also lives at the Lymphedema Education and Awareness Project website, which is lymphedemaproject.org. Next slide, please. All right, and so now we're going to go through the questions that were submitted in advance. There were quite a few of them. So if you have a question, you can go ahead and put it in the chat. And as we go through the pre-submitted questions, someone will be going through the chat, and we will get to those questions next.
I'd also like to mention, if you see any QR codes on your screen, there will be corresponding links in the chat as well. First question for Heather, what garments are covered?
We've really already covered this in that if you have original Medicare, all of your garment types are covered. There occasionally are some exclusions under certain private plans, but if you have Medicare, every type of garment is covered.
Are FlexiTouch machines covered?
Yes, they are. FlexiTouch is a brand of pump. And as I mentioned, the Lymphedema Treatment Act did not change coverage for any other type of treatment device, and pumps have been covered for many years, both under Medicare and all other types of insurance.
Is lymphedema massage covered?
Yes, manual lymphatic drainage is covered, but it has to be performed by a physical or occupational therapist. There are some massage therapists who are also certified lymphedema therapists, but Medicare and most other types of insurance do not typically cover services provided by massage therapists. So you would need to visit a PT or an OT in order to receive coverage for manual lymphatic drainage.
What will insurance pay in regard to compression garments and other things needed for therapy? Example, machine.
This is going to vary greatly depending upon the insurance plan. The only thing we can tell you for certain what they will pay is if you have original fee for service Medicare, after you've met that deductible, they're definitely going to pay 80%. But your out-of-pocket costs is going to depend on your specific plan if you have anything other than original fee for service Medicare.
Is there coverage for acupressure to help maintain lymphedema?
Not under Medicare, and as far as I know, not under any other type of plan, as this is not a proven effective part of the standard of care for lymphedema.
Is there coverage for water aerobics to help lymphedema? If not, can we lobby for coverage?
Very similar to the last question. No, there is not coverage for this as it is not part of the proven standard of care for lymphedema. And no, I do not think we could successfully lobby for this type of coverage, unfortunately.
Are you allowed to get leg garments if the lymphedema has moved into other limbs?
I don't really understand this question, but you would be eligible for coverage for any part of the body that has lymphedema. So I think the answer is yes, but there is not coverage for the prevention of lymphedema. So I know sometimes, especially in the case of breast cancer, women will be advised by their healthcare providers to get a sleeve as a preventative measure, especially if they're going to be flying or to exercise in. So there is not coverage for anything preventative in nature, but once you do have diagnosed lymphedema in any part of the body, then yes, there would be coverage in that limb or anywhere in the body, even if it's not a limb.
When lymphedema involves the legs, hips, and abdomen, pantyhose flat knit stockings may be covered by Medicare, but what about the alternative, which would be thigh-high stockings with biker shorts?
Yes. So we actually did discuss with Medicare when they were writing the rules that sometimes there are situations where even if all of the areas affected by lymphedema could be covered with one garment, the patient needs separate pieces, often because they lacked maybe the strength or the dexterity or the flexibility to put on a pantyhose can be very difficult. And so that sometimes needs to be broken up into different pieces. So when it comes to original fee-for-service Medicare, yes, there would be coverage for that. And there should be coverage for that as well with any other type of plan. I think you can make a very strong medical argument why it needs to be broken into separate pieces if the patient is simply not able to don or doff one piece to cover all of the areas. And I will also add here that sometimes there is a situation where a patient needs to double up on garments to achieve the level of compression necessary. And this is similar to this question in that if a patient cannot don or doff a very high level of compression garment, they might need two lower levels doubled up to achieve the same therapeutic benefit. And we had also discussed that situation with Medicare, that there needs to be those exceptions for when a patient needs to double up like that.
When a client is directed to wear an additional flat knit stocking over the base stocking to achieve a higher compression, will both stockings be covered by insurance?
And yes, what I just said. So yeah, sorry, I forgot that we had already received that question as well. So yes, that would be covered, but there is going to need to be documentation and the clinical notes as to why it is necessary to double up as opposed to just using one higher level compression garment.
I wear 5 pieces as a set with double compression on my left leg, foot, and thigh because I failed all other options. Because of the wording, the insurance company insists I have used all of my benefits for the year on just 1.5 sets. Is there any wording somewhere that can convince them that even if I require doubling up, that it is still one set and I still need 6 sets a year?
Yeah, unfortunately, even though we discussed this with Medicare, it is not written down anywhere in the rules. So unfortunately, we can't point to anywhere in writing that you can then use to convince other insurance companies that that should be their policy as well. Um, so I sympathize and I just encourage you to appeal. There's clearly strong medical justification for why this is necessary, and appeal, enlist the help of your doctor, your supplier, everyone, to help. And often you have to appeal not just once or twice, but you need to exhaust all of your internal appeals so that you're eligible for that final level of appeal, which is an external appeal. And an external appeal means it's someone who doesn't work for the insurance company, someone outside of their organization who's looking over the case. So it's often that the answer does not change until you reach that level of the external appeal. So it can be a lengthy and a frustrating process. But from my own personal experience, having been through many appeals with my son and worked with other patients on it, when you persist, the patient does very often win their appeal.
How common is it for a patient to order 2 nighttime garments at once instead of one every year?
I have no idea. We don't have any data about this, but my assumption would be if you're a newly diagnosed patient getting nighttime garments for the first time, you're probably more likely to get 2 at once so that when you do need to launder it, you have another one. If you've already been wearing nighttime garments for a while, then my guess is you're more likely to get 1 per year because you would still have one of your old garments as a backup if necessary. But I don't know what the actual statistics are on this.
That's a good point, Heather. What coverage is available to patients in a home health setting? How is that billed?
There is coverage available in a home health setting, and I would advise that you visit our page specific to this scenario for more detailed information. And it is going to vary, of course, by insurance type as well.
And that link has just been shared in the chat to access that information. As a CLT Lana who holds a massage license, it is often difficult in my state to get coverage for people's garments. The 2 major DMEs that I use to send people to have gone out of business or have stopped doing lymphedema products. My only option is to send to a business that also offers the services of CLTs, which is obviously less than ideal because they technically are a competitor. Is there any other way to get insurance coverage for my folks for garments?
Right. Well, short of becoming a supplier yourself, you obviously do have the option to use a nationwide online supplier that would ship the garments to your patients. And you can find those options through our supplier directory. I believe there's close to 30 different businesses listed in our supplier directory who ship nationwide, and that is the core of their business. And then there's many, many more who will ship nationwide, but they're more focused on being serving the local community. And if you are interested in becoming a supplier, that other QR code there will take you to a page of information on how to become a registered Medicare supplier if you truly are interested in being able to sell garments directly to your patients and bill Medicare for them.
The link to become a supplier is in the chat in addition to the supplier directory. How can a client get Medicare to pay for the bandaging supplies that the client is entitled to have? Are there any vendors that will accept the Medicare payment for these supplies?
Yes, there are vendors who do accept Medicare payment for bandaging supplies, and you can find them through our supplier directory. That's the QR code there and the link that's already been put in the chat. I know there are some suppliers who do not sell them because the reimbursement for those items is fairly low, but there are some suppliers who do. So as long as you use a supplier who's going to bill Medicare, there shouldn't be any issue with Medicare covering for them. I've actually, through our denial reporting form, I don't think we've gotten a single report of Medicare denying bandaging supplies, only sometimes hearing from patients or therapists that they're having trouble finding a supplier who sells bandaging supplies and bills Medicare. But there are some, and you can find them in our supplier directory.
What is your advice from someone who needs custom compression garments with limited in-network suppliers that are local? My Advantage plan is only paying about 1/3 of the cost of custom garments. How can I get coverage for more of the actual cost of these garments?
So, starting with the last question first, the patient has no power to negotiate a higher reimbursement rate for the garments. That is a contract between the supplier and the insurance company. So the patient does not have any leverage to get a higher reimbursement rate for that supplier. Um, Many patients do not have the option of a local brick and mortar supplier who sells what they need and is also in network, particularly when it comes to custom garments and particularly when it comes to Medicare Advantage plans. But there are several nationwide online suppliers who do take a wide variety of insurances, including most of the major Medicare Advantage health insurance companies. And I would encourage you to look there for a supplier that takes your insurance and sells the custom items that you need. We understand that this can be challenging. It's actually one of the key things that our organization will be putting in our public comments about the Medicare Advantage program when I mentioned earlier that you can submit comments until next Monday, January 26th. It's one of the key issues that we are raising is a problem with the Medicare Advantage plans is the lack of in-network suppliers.
In need of a list of, of suppliers who carries Medivin compression stockings and honors the Lymphedema Act for payment or reimbursement. Previously, I was reimbursed twice for my purchase of stockings, but the third time I submitted a claim with the same information, I was denied reimbursement. I appealed and was denied again.
Okay, so we are actually in the process right now of adding major brands sold to our supplier directory. So now when you look for a supplier, you can also see what major compression brands they carry. So hopefully that will be helpful in enabling people to find a supplier that covers the brands that they carry. And then in terms of wanting a supplier who also honors the Lymphedema Treatment Act for payment and reimbursement, you want to look for a Medicare supplier that identifies as participating, because as I explained earlier, if you are a participating Medicare supplier, you are required to accept claims on assignment and only charge the set Medicare fee schedule amount. The other part of this question, why you were reimbursed twice, but the third time it was denied, I don't know. I would need to know more details about that situation. If this is a Medicare beneficiary and the third time was the third set in 6 months, certainly there should not have been a reason why it was denied, but there's really not enough details here for me to address that. So if this patient is listening or watches the recording later, please contact us through the Lymphedema Advocacy Group website with more details, or submit this information through our denial reporting form, and I can look for the details there.
In need of list of doctors who treat lower extremity primary lymphedema in the south suburbs of Chicago. To date, I am unable to find a doctor since my previous doctor no longer is covered by my insurance. My lymphedema is primary, so not related to cancer. In my search for a doctor, the only doctors who are familiar with lymphedema are oncologists, which I have no need.
Yes, this is frustrating. Um, Again, we do have not supplier directories, excuse me, provider directories on our patient resources page. The QR code there is there at the bottom, and I'm sure they'll be putting the link in the chat. And those provider directories, often it's primarily therapists who are listed, but there are also doctors as well. There are just fewer of them. And I happen to know that Dr. Feldman is in the Chicago area. So I would look for that name. You might even be able to find him just through a Google search and see if his practice comes up. So that's Dr. Feldman, I believe, is in the Chicago area, but also use our provider directories on the patient resources page.
I'm unable to find a doctor in my area who specializes in lymphedema. Consequently, I am unable to find a supplier who will allow me to purchase stockings, let alone reimburse me for a pair of desperately needed compression stockings. I have United Healthcare insurance.
So I'm assuming that the problem here then is the lack of a doctor who specializes in lymphedema means that the patient doesn't have the proper prescription, maybe not even the proper diagnosis to be eligible for coverage. And that's part of the obstacle to then using a supplier and using their insurance for the compression items. So again, using the provider directory that we just referred to on the last slide may help you to find a doctor. But in the absence of finding a doctor who specializes in lymphedema, know that any doctor can diagnose lymphedema and write a prescription as long as it's within their scope of practice. So even a primary care physician can diagnose and prescribe what you need. Now, if you can't find a doctor who is already familiar enough with lymphedema to do that, one of the handouts we have on our education page is specifically for providers, and it has links to a few different publications to help guide doctors in the right direction to getting enough knowledge to be able to confidently diagnose their patients with lymphedema and write a proper prescription. It also has details on there exactly what needs to be included in the prescription, the level of detail, what types of clinical notes, how they should coordinate with the therapist and with the supplier to get the patient the items that they need. So I would encourage this patient to use use the provider directories on our patient resources page, and also use the provider handout on our education materials page, and take that to their primary care physician or whatever doctor they are seeing if they cannot find a specialist within their area.
According to my United Healthcare plan, my lymphedema garments are, I assume, to be covered. They have confirmed this, but every year I have to fight with them to get my garments covered. Last year, even though they showed coverage existed and had been paid in the past, they still denied coverage, making me pay over $1,300 out of pocket. How should these situations be handled?
Yes, I sympathize completely as I've been through this for many years with my son. Um, Many of the times that his garments were denied, they were denying them because a lot of private insurance plans have a clause in them that says there is no coverage for elastic or support stockings. And the first step is clarifying that lymphedema garments are not at all the same as the elastic support stockings that those exclusions refer to. Those exclusions are talking about the off-the-shelf garments that you can buy at a drugstore, not medical grade prescribed lymphedema compression garments. So often I've won appeals just by clarifying that the garment is that the exclusion in the policy doesn't actually refer to the type of compression garment that my son was prescribed. Um, but sometimes you do have to go even further than that. And I understand the frustration that it's not precedent setting even for the patient. You can get something covered once and still have to go through the same process, show all the same evidence, jump through all the same hoops the next time to get another set of garments covered. I sympathize, but again, I encourage you to appeal as many times as you need to, even if you need to get to that external level of appeal. and use the resources on our appeals resources page. There's a lot of good advice there, including if you have coverage through an employer, you can often utilize the support of your human resources department. And if it's a private plan, I really encourage you to reach out to your state department of insurance or your insurance commissioner. Every state has ombudsmen that are there to help consumers with issues like this. They cannot force the insurance company to cover your items, but they can, with your permission, communicate with your insurance company on your behalf. And I promise you, the reaction from your insurance company will be much different when they hear from the Department of Insurance than when they hear just from you. I found that they were much prompter in responding to my appeals, and I could win my appeals much more quickly once I enlisted the help of my Department of Insurance. So I encourage you to do all of those things. I know it's a frustrating and sometimes lengthy process, but you are highly likely to win.
Why is my provider having such a hard time getting paid from Medicare?
I would need a lot more details to be able to answer this question because it could be for so many reasons, including the possibility that they're not actually filing the claims correctly. So there has been a big learning curve as these benefits have been implemented because a lot of the providers, and by provider, I assume this person means their supplier of their compression supplies, a lot of these businesses didn't take insurance at all. So it's not just that they weren't used to billing Medicare for these items, they weren't used to billing insurance at all. So it's been a big learning curve for these suppliers to implement this. And so a lot of times when something is denied initially, it's just because they didn't have the proper documentation or not everything was filed correctly. So without knowing more details, I couldn't say why they're having such a hard time getting paid from Medicare. But again, I would encourage this patient, if they're watching tonight or on recording, to use our denial reporting form or contact us through our website to get more information to us.
Given the popularity of weight loss therapies, what avenues are available for individuals to replace garments that become too large before their garment replacement renewal date?
So in the Lymphedema Treatment Act rules, it does allow for the replacement of garments even before the 6-month window is up in the case of daytime garments or the 2-year window for nighttime garments if the patient's circumstances have changed, such as due to weight loss, and their current garments are no longer fitting properly and providing the correct therapeutic value.
Physician/OT prescription specified BLE A6526, but vendor delivered A6527. I had to pay cash up front and vendor submits for my reimbursement. Will Medicare pay for A6527 if prescription says A6526?
I would say definitely not. They're not going to pay for a custom item, which is obviously a lot more costly than a standard fit item if the prescription said standard fit. So this is a mistake on the part of the vendor, and it should be the vendor's responsibility to absorb the difference because that is not what was prescribed for this patient, and the claim will probably be denied, and the patient should not be responsible for paying for the difference.
Vendor requires payment upfront for DME compression garments, and they submit claim on client behalf to Medicare for reimbursement. Vendor has submitted several claims that were rejected due to with billing errors. They incorrectly continue to submit item on one line despite having claim rejected and do not contact their resource. This nighttime pantyhose must be submitted on 2 lines, each unit specified right or left on Form 1500. If I submit a Form 148S on my 148OS on my own, will it be a duplicate submission? Does that make any difference?
Wow, this is a very knowledgeable patient or therapist. um, First of all, if this has been an ongoing problem with this DME supplier, I would recommend using another supplier. Because certainly mistakes happen, and certainly there is a learning curve, as I was talking about, but it shouldn't be an ongoing problem that claims are submitted incorrectly. That's my first point. My other is obviously this vendor is non-participating and not accepting the claims on assignment. So by choosing a participating supplier or one that's non-participating but still accepts the claim on assignment would mean that the client, the patient in this case, does not have to pay anything upfront. So that would also be a benefit. In terms of submitting the form on your own, yes, I would assume, this is not my area of expertise, but I would assume that if the DME supplier has billed for it and then the patient submits it on their own, it is going to be seen as a duplicate submission. Um, However, I would encourage you to do two things. One, use the insurance appeal resources page on our website, and also contact Medicare. I believe we have a slide coming up soon that does have some contact information for the Medicare program, and specifically ask this question about if it would be considered a duplicate submission. This is an unusual situation that the patient or the therapist is being this proactive, but very glad to see that they are, because this shouldn't be a problem that continues to happen with the same supplier.
If a Medicare claim is submitted by a vendor on my account, I do not get notification, MSN, if it is approved or declined. Is there any way to get a notification for these claims so that I can monitor status? There is a 1-year limit to submit an acceptable claim from date of service. I do not know that claims are denied.
Hmm. I am not a Medicare beneficiary myself yet, but you always have the right to get information about your own, insurance claims. And if you're not automatically receiving that information, I'm sure there is a way to contact Medicare and get that information. Um, so I would encourage them to do that and to make sure that they do it, in ample time so that they're within the 1-year limit to take any action that they need to if they find that a claim was denied. I would encourage this individual to also contact us directly, and maybe we can talk through this in more detail, and to also use the information that's coming up on a future slide to contact the Medicare program perhaps and get their advice about how to handle this situation.
Once prescription is written by a doctor, is it annual or renewed every 6 months? Specific language in prescription?
It depends on the plan. Um, how long the prescription is good for. 6 months, a year, some are even more than a year. So you're really just going to have to check with your own insurance plan to understand how long that prescription is good for. And I'm not really sure what they're asking about specific language on the prescription, but it does need to be quite detailed now that we're dealing with insurance. So that provider handout that I referred to, and we also have a supplier handout with similar information. It gives examples of how specific the language needs to be on the prescription and in the clinical notes. In the past, when the prescription wasn't involved, it could be very vague, like compression garment for both arms. And then if the patient was paying out of pocket, they would just work it out from there. But now it has to be very specific about the type of garment, the level of compression, whether it's custom or standard fit. There needs to be a lot more specificity in the prescription language. So you can find examples about that on both the supplier handout and on the provider handout available through our website.
As lymphedema is chronic, why aren't coverage/benefits that are dependent upon documents like prescription or referral good for more than 6 months at a time? I can wear my regular garments a lot longer than 1 year, but my lymphedema medical grade garments wear out much more quickly. They usually have to be worn 24/7. They have to be changed/laundered more often and reworn quicker than my regular garment. So I need more sets to change into. Either let me order more or make the documents qualify me longer so I can wear clean ones to the doctor.
All right, so regarding the first part of the question, just as with any chronic condition, a patient's circumstances can change over time. So the need for an updated prescription, and sometimes you have to have been seen by the doctor within a certain window of time, is to make sure that the treatment being recommended and that the compression garments, in this case, that are being prescribed are still the correct ones for that patient's current need. So it's not just to make our lives more difficult. There actually is a sound medical reason why prescriptions have to be, renewed after a certain amount of time. In terms of wanting to get more sets of garments, I believe that we were very fortunate to get the allowable quantities that we did under the Lymphedema Treatment Act rules. Prior to passage and implementation of the Lymphedema Treatment Act, the plans that covered garments typically allowed at most 2 sets of daytime garments every 6 months, with the logic that you're washing one while you're wearing the other. But we made the argument that there's cases where you need more than two. Maybe you spill something on your garment during the day, or you go work out at the gym and it gets sweaty, and it would be unsanitary and an infection risk to not change into a clean, dry garment. Or maybe your garments need to be hand washed and they don't, or hand washed and then air dried, and they don't necessarily dry fully overnight by the next day. So there's situations where you really need to have 3 garments at one time to make sure that you always have a clean set to wear when you need it. So we were successful in getting 3 sets every 6 months, which I understand some patients would like more. I recall there was one patient during the rulemaking process who insisted that patients should get 7 sets of garments at a time, so they only needed to do their laundry once a week. But unfortunately, medical rules with lymphedema and everything are not based on our convenience. They're really only based on what is medically necessary. And so that relates to that part. And the last section, either let me order more or make the documents qualify me for longer. Well, I think we've already addressed that with answering the first 2 parts of the question. I do understand it would be more convenient to have more, but I do feel that we are fortunate to have the coverage that we now have with 3 sets.
What are the deadlines for a return or replacement of a garment that is defective or the wrong size?
This is going to depend a lot on the type of garment that it is and the manufacturer who it comes from. So obviously, L&R cannot answer for other companies, but perhaps someone from L&R would like to jump in here and at least indicate what your window is for return or replacement of garments.
Sure. So regarding the Solaris collection, they have a 6-month warranty for those garments. It is stated for defective garments, but we will also work with you if it's the wrong size. Next question, or would you like to elaborate any more?
I will just add that, from my personal experience with my son, that we've never had an issue with a problem after we brought a garment home, but sometimes in the case of a custom garment, it just doesn't fit right the first time. So it's not even coming home with you that first time you try it on there at the supplier. It's being sent back automatically to be remade if it's not fitting correctly the first time.
How can L&R assist clients whose vendors are not timely in responding to the client's concerns with defects or fit, such that the return window is missed?
Go
Well,
ahead, Kristen.
sure, I'd be happy to. If you are not getting a timely response, you can call our customer service. And in some cases, we have reached out to the vendor on the patient's behalf. As long as we have the communication started prior to the warranty expiration, we will honor it. What is the best way to learn about custom wraps? I see a few in ads, etc., and I would like to try one.
Well, for patients or therapists, if this is a therapist, um, I've found it incredibly helpful if you have the ability to attend a conference that has an exhibition hall. It's a great way to just see and touch and often even try on different types of products. But I realize that not everyone has that opportunity to do that. So I would check with your local suppliers to see if they have samples of any of the products that you are interested in learning about, or check with the manufacturers directly of those products. And oftentimes they'll have sales reps, and you could perhaps coordinate when they're going to be in your area to meet with a sales rep to learn about those products. And I don't know if there's anything you want to add to that, Kristen.
In addition to your therapist, should be able to provide you with samples and to show you the different garments by different manufacturers as well. I've been wearing Joe's compression thigh high for 46 years. I have had an open ulcer on my heel for about 6 years, so I need to bandage that, and for protection, I need to wear a padded boot up to my knee. I wish you could help me find something different. I have no feeling or muscle in my left leg, so I can't walk without a brace and electric scooter.
Yes, I wouldn't be qualified to recommend something for this patient. This is a clinical question. And so I would encourage them to talk to their doctor or their therapist or their supplier or all three about their options. And if none of them are knowledgeable and able to help with this, perhaps using the provider directories to see if there is any other uh, provider in the area that might be able to make a more helpful recommendation.
Is there coverage in Jamaica?
I have no idea. It is not a US territory, so I have no idea.
And last question. I currently live outside of the US and have a global policy. I don't think they will cover my compression stockings because I have a high deductible. I will be eligible for Medicare in July. I wonder if they will pay for my compression garments.
I don't know what the Medicare policy is for coverage when you are outside of the US, but I would assume that there is some provision for this. Is, certainly members of the military are often outside the US for extended periods of time, and are still eligible for medical coverage for their needs. So I would encourage you to contact the Medicare hotline. So at least you can find out what your options will be starting in July once you're eligible for Medicare.
All right, I'm going to get just to the questions here that have been put in the chat. First one, if a patient orders garments and then decides to return them within warranty through the same Medicare accredited supplier for any reason, does the Medicare coverage clock reset for day and or night garments?
I don't know the exact answer to this question. Um, I'm assuming that they're asking under the scenario that the claim has already been submitted to the insurance company. But I would assume if the garment is returned and a replacement is not going to be issued, that that claim would have to be withdrawn, in which case the clock would reset. Now, if the item was being replaced, like through a warranty situation, then I would assume that the clock would not reset because you are still getting the garment. But I understand there is still the question then, is is the clock start from when you get the replacement or from when you got the original? And in that case, my assumption would be from when you got the original one. But this is not a question that we have received specifically before. And I did go ahead and check with the US Medical Compression Alliance, and they were not certain either. So I know they're going to do some more digging and try to get a definitive answer on this one.
That's a great question. Can you send out the presentation deck or at least pages with QR codes and site info?
I believe that Eleanor is planning to share the recording. And Kristen, I don't know if you were planning to share the deck or not, the
If it's
slide
not the
deck.
deck, we'll send out a summary, which will include site information and links. So either there'll be the deck or some sort of summary that you will receive. Next question, is there a list of garments that are approved for Medicare? Some garments are not approved per vendors like SunMed and Compression Care.
Well, there is a fee schedule by Medicare, and as I said, every type of compression garment does fall somewhere under that fee schedule, even if it's not a code specific to that type of garment, and it falls under an umbrella code that covers more like a general category and doesn't have a set reimbursement rate because they're determined on a claims by claims basis. So that fee schedule is available through our website or online elsewhere, but the easiest place to find it is on our website for lymphedemaadvocacygroup.org. And then if you go to the supplier information page, which is underneath the insurance tab, and there is a link to the 2026 Medicare fee schedule where they can see that list. Now, I don't know if they're asking about a list by brand, but there are no brand exclusions under Medicare. Now, if you have a private insurance plan, private insurance companies can do brand exclusions. I'm not aware of any, but they do have the right to do that. But perhaps what they're asking is to do with a supplier who does not sell a particular brand because their reimbursement is not sufficient with that brand. And the supplier does have the right to sell some brands and not others. So perhaps that is the issue that they're referring to. But I hope that kind of addresses all possible aspects of their question.
Do I need the HCPCS codes in order to get the items I want covered? I need juxtafit items and can't be sure of the codes.
If this is a patient asking, you shouldn't be responsible for knowing the codes yourself. However, again, if you want to see what the codes are, you can find them in the way that I just described by going to lymphedemaadvocacygroup.org and then underneath the insurance tab, selecting the supplier information page and then looking at the fee schedule, and the fee schedule will have the code associated with each type of item. Now, codes are not specific to different brands, so you're going to need to look for the description, like if it's a 20 to 30 level of compression custom fit knee high, there would be a code for that, but it's not going to say the brand.
Do you have an outline assisting with billing for garments and accessories? Are there certain modifiers that are needed? Do Advantage plans require different modifiers?
We do not, but I would contact the U.S. Medical Compression Alliance and see if they have some kind of guidance or template that they can provide.
All right, just a couple more here. Do you anticipate the reimbursement rates for Medicare will be changing or updated on a regular basis?
Medicare reimbursement rates are always updated on an annual basis, and this is tied to the rate of inflation. So it's pretty much standard across the board for all DME items that Medicare sells. So yes, there are small incremental increases from year to year. I do not foresee any significant changes with coverage for existing items that already have a set fee schedule amount. So the only significant changes that might be on the horizon is, as I said, there are some kind of catch-all umbrella codes that have a variety of different products that would fall under that code. And as more claims are submitted and Medicare can see that there is a need for a code for an individual item that falls within that umbrella code, they do create new codes. So there are some new codes coming out this year for that reason. And as new codes are created, those codes may be assigned fee schedule amounts. So that would probably be the only significant change on the horizon.
And lastly, can cotton stockinette be covered?
If it is part of your supplies that go underneath your compression garment, then yes, it should be billable as an accessory.
Right. And an unlimited amount, correct?
Yes, because there are no caps on accessories.
Well, it looks like that's all the questions we have answered. I'm going to move on to the next few slides here.
Yeah, so we would like to invite you to attend our next patient webinar, which is on February 26th. That is hosted by our group, the Lymphedema Advocacy Group, but we're also going to have speakers from the U.S. Medical Compression Alliance and from AccuServe. And so this is going to be a much deeper dive into the billing aspect of compression garments, including how to deal with problems when they occur, whether that's through the ordering process or after the fact, how to read your EOB statements, and really how to best advocate for yourself as a patient to make sure that you understand your rights and getting all the coverage that you're entitled to. So we're going to be sending, if you registered for this webinar, you will get an invitation to register for this next webinar, and we anticipate that that will probably go out sometime next week.
Follow us on social media. Please follow L&R and the Lymphedema Advocacy Group on social media. L&R will keep you updated on product information, and we will post all our webinars on our webpage and YouTube. If you're not signed up already, subscribe to the Lymphedema Advocacy Group's newsletter and join their mailing list to be updated on changes to insurance coverage, advocacy actions, new educational materials, and more.
So thank you so much to everyone who joined us tonight, and we hope to see you again on a future webinar.
Thank you, everybody. Have a good night.